A rare strain of Covid-19 has been detected in Oman. The project, which was jointly undertaken by the University of Nizwa and the Ministry of Health, looked at 94 samples of the virus taken from patients in the country. Its results have now been published in the International Journal of Infectious Diseases. P323L is the most common mutation of the virus found in 94.7% of samples studied, followed by the D614G spike protein mutation present in 92.6%. A unique mutation, 1280, was first reported in Oman and was associated with a rare lineage, B113, found in only 10.6% of samples. The study illustrates the future importance of molecular epidemiology in leading the national response to outbreaks and pandemics, said Dr. Ahmad Sulaiman Al-Hazari, the founder of Natural and Medical Sciences Research Center. We are currently continuing our collaboration with the Ministry of Health by sequencing the coronavirus from infected health workers as well as patients who have been infected more than once, he added. Samples were selected based on epidemiological characteristics that represent various cluster types, geographical location, and nationality, said the report. The epidemiological investigation was conducted by public health teams throughout the country who fed data into a national electronic database. The study selected patients based on a number of considerations, including age group, nationalities, the severity of illness, infection date, places of travel and residence, and others. The research team included molecular biologists, epidemiologists, and bioinformaticians from NMSRC and Oman Ministry of Health. That step took about 3 weeks for the Pfizer-BioNTech and Moderna vaccines, but could be faster this time around. The final green light will be then given, probably the next day. Johnson & Johnson announced at the end of last week the first results of its clinical trials, carried out on nearly 44,000 people in 8 countries. The vaccine was overall 66% effective, the company said, and it is 85% effective in preventing severe forms of the disease. But these results also raised a concern. The shot was more effective in the United States than in South Africa, where a variant that had appeared in the country has now become dominant. Meanwhile, Johnson & Johnson also said that it has initiated rolling submissions with several health agencies outside the US and will submit a conditional marketing authorization application with the European Medicines Agency in the coming weeks. News Desk Kamudi, English.